Good afternoon, everyone, and welcome to the virtual speaker series. I'm Paul Clifford, CEO of the Penn State Alumni Association, and today's session is titled Biomedical Data Sciences and Artificial Intelligence, a guided tour of research in the Penn State AI Lab. Live closed captions are available. You can access them by clicking the button at the bottom of the Zoom video window and then click Show Subtitle. You may also customize your caption view by clicking the stream text link posted in the chat. And we are live streaming today's presentation, which will be archived on our website. Today's guest is Dr. Vasant Honavar. He is the professor of data sciences and informatics, computer science, and bioinformatics and genomics here at Penn State, where he holds the Dorothy and Lloyd Huck Chair in biomedical data sciences and artificial intelligence. He'll speak on a topic that's taking on increased importance, the unprecedented advances in our ability to acquire and process diverse types of data, and the resulting emergence of big data offers unprecedented opportunities for accelerating discoveries in virtually all areas of human endeavor. Dr. Honavar will describe several examples, draw from research in his lab, and provide some examples of methods advancing in machine learning. He'll also then conclude with a brief discussion on some open problems. Thanks for joining us, Professor Honavar.
Thank you.
I'm going to turn it over to you.
Thanks. Can you see the screen?
Looks good.
Okay. Let me get started. So I just wanted to first introduce my lab. So I have a wonderful group of graduate students that I work with and many collaborators at Penn State and beyond. And many of the alumni of the lab are now either faculty or leading researchers in industry in AI and related areas. Okay, so first, to set the stage, let me say a few words about AI and machine learning in general terms before we dive in. The reason for this is that AI has become such a buzzword these days, and it means many different things to many people. So we have to maybe sort of frame it in terms of what we are going to talk about here. So the AI, the working hypothesis of AI is basically that computation provides for thinking or cognition what calculus provided for physics. What do I mean by that? It means that you can use computing as a medium for modeling cognition, which includes all aspects of intelligence. And we will have a theory of intelligence when we have information processing models or programs that display some aspects of intelligent behavior. So AI has had many different goals over the years. One is a study of computational models of intelligence. A second is more of a scientific goal, which is, hypothesis about intelligent behavior, which you can test by building programs that display intelligence. A third one is more of an engineering goal, which is construction of intelligent artifacts that do things that otherwise would require intelligence if performed by humans. Automation of tasks requiring intelligence, maybe tasks that are too cumbersome for people to do. The definition that I really like is augmenting and extending human intellect and abilities. So AI is not necessarily to be seen as a replacement for human effort, but rather one that augments it and complements it in useful ways. And last but not the least, you can also think of AI as the study of the design space of intelligent systems. Human intelligence is one point in that design space. Various types of animal intelligence are other points in the design space. And then, of course, artificial intelligence also occupies the same space. So we can look at various dimensions of that space and see, how these different types of intelligent systems relate to each other. Okay, so machine learning primarily is about replacing humans writing code for specific tasks with humans supplying data, objectives, and feedback for training machines to perform those tasks. Right? So machine learning can be used to discover hidden structure in the data. It can be used to learn predictive models from data. So for example, you might want to look at an individual's clinical record and use that to predict the risk of heart disease. You can uh, learn generative models like the large language models, which can be used to produce natural language responses to human queries. You can learn preferences and rankings over possible alternatives. So for example, your preferences over products or on a site like Amazon. You can use it to learn causal models from observations and experiments. Prediction is nice, but sometimes you need to know what's leading, what is the cause of a particular outcome in order to be able to intervene, and so on. Okay. And so my interests and my lab's interests span machine learning, causal inference, knowledge representation, and applications in bioinformatics, health, and related areas. So today what's going to tie all of this work together, even though it seems disparate, is this idea that you can use algorithms or computation as a way of understanding phenomena, whether it's intelligence or biology. There is a useful way to look at it through the lens of computation. So the general philosophy of our lab is that we are not students of some particular subject matter, but students of problems, and problems may not necessarily fit into the borders of any particular discipline. So a lot of the work that we do necessarily spills over and crosses over to other fields, and we work with experts in other disciplines as a result. Okay, so you already heard about big data, and of course that's been the case for more than a decade, maybe 2 decades now, that there are many fields of human endeavor where large data sets have become easier and easier to gather. So for example, now a full genomic sequence for an individual can be obtained for about $500. So the entire genomic sequence. Right? And the same is true through advances in digitization for every field, all the way from sciences, behavioral sciences, and humanities, and health sciences, and biology, and physical sciences, and virtually any area that you can imagine. Right, so this presents many challenges. And so I'm going to go through a few of, very quickly, because I don't have a lot of time to get into all of the details, but I just want to present to you some problems that we are working on, right? And the approaches, if you're interested, there are references you can follow up on. So one idea that's grew out of this emergence of big data is the following. In many fields, there are data sets that are physically distributed and owned by different entities. So for example, you can think about many different hospitals that are not able to share their private data with each other or with a central entity. However, it is useful to mine this data to learn something about that might be helpful to the patient. So for example, you might want to mine the electronic health records maintained by multiple hospitals to learn a predictive model of risk of heart disease. Right? So how do you do this? The basic problem is the following. You have a learning algorithm that works with the data set that you have. Let's say you take your favorite learning algorithm. How do you turn it into one that can work across these disparate data sets where you don't necessarily have direct access to the data? So maybe, for example, each data source might answer some statistical queries against the data, and you can use that to build the predictive model. So this leads to many different algorithmic challenges. So we have, over the years, worked on many of those, and this is still ongoing. And there are many different types of data fragmentation that you can imagine. One is the so-called horizontal fragmentation, where different sites have different subsets of patients. The other is vertical fragmentation, which is fairly common in many problems, for example, security, where each data source contains only a few of the variables that are relevant for the problem domain. And it's not possible to join all of those data sets because of regulations or privacy reasons and so on. So you still want to be able to learn predictive models. So this is one problem. The second problem, which is of growing interest and relatively open at this point, is this problem of so-called continual learning, right? So the standard machine learning, you're given a data set with a few class labels and a set of samples that are previously labeled, and you learn to, for example, try to tell, one class from another, so apples from oranges, or and so on. Now, let's say that instead of being given all of the data and all of the tasks at once, suppose they show up over time. And this is a more realistic scenario. We cannot predict ahead of time all of the tasks that I might ever want to perform, and the data relevant for all of those tasks to gather them upfront. But suppose they arrive sequentially over time. So what happens with current algorithms when you apply to these problems is that there is this phenomenon called catastrophic forgetting. So when you train a model on a new task, it forgets how to perform the previous task that it has been trained on. And this is a major problem for most of these modern deep learning methods. So a challenge that we are currently trying to address is how to develop algorithms that can avoid catastrophic forgetting and avoid having to retrain on old data and old tasks as you learn new tasks. Okay. A third area of research for us is so-called knowledge-informed machine learning. So most classic machine learning approaches start with a data set and try to fit a function. So you have a pairs of X and Y, and you try to learn a model that maps X to Y. Now, there are many cases, though, where there is considerable physical or other types of domain knowledge that is available that could be used to make the task easier, perhaps make the models more understandable to humans. And so the general problem is how to incorporate this prior knowledge into learning algorithms in a way that improves their performance. Right? So one example of that is incorporating physical constraints into neural network models. So graph neural networks have been used for molecular modeling and many other applications. But from the physics of the domain, we know that certain invariances and equivariances that hold should be modeled. And if they are modeled, then you can reduce the data demands for that task considerably. Yet another problem domain is learning complex representations from data. So here I've shown some examples. So one case, it's a complicated network of interactions among proteins. In the other case, you have essentially an individual with sensors placed all over their body performing some physical activity. And you want to capture the signals from each of those senses and try to understand movement. Perhaps in the case, if you might want to learn dance moves, you might want to detect a risk of some individual falling based on their gait. So these are complex data. This is continuous data that's being gathered over time, and you want to be able to learn representations of this data so that you can use them for downstream tasks. Another example is patient records, where you have patient visits to hospitals over time. They happen at irregular time intervals. At any given time, thousands of variables could potentially be measured, but only a handful of them are measured at any given point based on what the physician thinks is relevant. And this data has many complex correlation structures. For example, the data about a particular patient is correlated over time. Data for similar patients would be correlated across patients. And this requires learning latent representations of this data that capture those correlations. Next area of topic of research for us is multimodal and multi-fidelity learning. So the basic idea here is that you can look at the same underlying physical reality through many different modes of observation. So one example is in the healthcare setting, you might have genomic data. you might have electronic health records data, you might have imaging data. So these are different modalities, and you're trying to use them together to understand something about the underlying phenomenon. In this case, maybe the development of a disease, right? So that's one problem, where the different data from these different modalities, you're trying to pull them together. It's a classic data fusion problem, but modern machine learning can help improve the fusion considerably. The second problem is that there are many applications where you can measure roughly the same thing at different levels of fidelity, because measurement devices have different accuracy, different noise profiles, and so on. The cheap data may be coarse, more expensive data may give you higher quality information, but generally, because more expensive, you want to be able to get away with the cheapest data that you can use and revert to high quality or high fidelity data only when it is necessary. So this leads to a bunch of different problems, all the way from uncertainty quantification to how to adaptively utilize data across multiple fidelities. And here's another example from some of our recent work. So this is focused on particularly in healthcare. And this the problem setting is motivated by the use of electronic health records for predictive modeling of health risks and other problems. So for instance, just to illustrate what the challenges of this problem are, so you have different individuals that show up at hospital for visit at different points in time. They don't necessarily show up every day or every week. They show up when they need to, right? So that means there are arbitrary gaps between data points. So this is not time series. This is irregular longitudinal data. Then at any given point, on any given visit, maybe a few procedures are carried out, or a few measurements are taken and they're recorded. Maybe a few medications are prescribed and that's recorded. And then you have this series of visits. And the data that you're observing doesn't tell the whole story, because there's a lot that you cannot directly observe. So for example, you might have certain observations that is because of the fact that the patient just got infected with the virus, right? We don't directly observe the virus infection. What we observe is the result of it. Maybe the person has high fever, maybe the person has cough, maybe the person tests positive for COVID, right? So these are the observations. And so there's a complex dynamical system with unobservable states, latent states that you cannot observe, but the data that you can observe is what you're going to use to infer something about the latent state. And you can imagine many different important problems here. So predicting the risk of a particular illness so that you can take some interventions, put in place some interventions early on. You can look at how somebody's risk is changing over time. You can look at how different patients are similar or different in terms of how they respond to particular medications. All of these problems fall in under this general umbrella of learning from longitudinal data. And then we also work on some problems in knowledge representation and inference. One example is being able to encode individual preferences, particularly qualitative preferences. So things of the nature where you say, I prefer a cheaper car to a more expensive car, only if it's not less safer, So and without necessarily being able to say by how much, right? So this is often the case. People have preferences. They're not able to quantify their preferences. And so we've been working on languages and reasoning algorithms for dealing with these disparate preferences. The next area of work for us is causal inference. So causal inference is incredibly important and maybe an understudied aspect of AI and machine learning. So just to illustrate the importance of the problem, at the top left of the slide, you see a picture which shows almost perfect correlation between deaths by suicide and hanging in the United States and science spending in the United States. So given this, a kind of correlation, if you know one of those variables, the number of hanging suicides, you can almost perfectly predict science spending in the US during that year. But there is any a moment's reflection will tell you that there's likely no causal relationship between those variables. So this correlations are useful for making predictions, but they don't tell you anything about what the mechanism is. Whether two things are correlated because they just happen to be correlated. Maybe they have a common cause, some complicated relationship between other variables that makes them correlated, but it doesn't necessarily tell you why they're correlated. And most of classic machine learning relies on correlation to make the predictions. However, if you want to intervene, then you need to know something about the causal relationship. So for example, it's not enough for me to be able to tell a patient that they have an elevated risk of heart disease. I need to be able to tell them what they need to do in order to lower that risk. And there will be many variables that are correlated with that risk, but only a few of them will be causally related to the risk. And we want to identify the causal variables. And the last decade or so has seen tremendous advances in causal effect estimation from observational data through interventions and so on. And we have worked on a number of problems in there. And even problems where you can ask questions about whether some particular research finding can be generalized from one setting to another. So for example, you might have run a careful study in one city, let's say Los Angeles, and then you want to see whether those findings actually hold in, let's say, New York City. And New York City is not the same as Los Angeles. Its demographics is different, and you can't afford to run the same study in New York City. And this is the so-called causal transportability problem. And it turns out, quite surprisingly, actually, that there are cases where without actually repeating the study in New York City, you can figure out how to take the finding in Los Angeles and tweak it so that it actually holds in New York City. There are also cases where you cannot do so, and therefore you have to run a study. And another area of application for us is life sciences, which is deeply connected to healthcare as well. So here, what we are interested in is problems like, does a particular protein bind to some other protein? And this is a problem that's important for drug discovery and related things. We are also interested in using different types of omics data to predict clinical outcomes. So here's an example from cancer research. And the second example is from predicting the biomarkers for inflammatory bowel disease. The next one, so the healthcare setting, the primary challenge is that health outcomes are dictated by many different factors. And the chart over here shows that among the many different health conditions, that particularly chronic diseases, a tiny fraction of the health risk is explained by one's genetics. So there is a large fraction of it is, would require, the variability would require many other factors to explain. And that includes a lifestyle, it includes the environment, it includes things like even socio-demographic factors, where you live. So there's a famous paper that talks about how one's zip code may have more of an influence on one's health than the genetic code. Right. So one of the holy grails in this area is to try to understand how these factors interact to determine the health outcomes. So we've been working on creating some infrastructure and methods for tackling these problems, starting with essentially the electronic health records data at Penn State Health, and then bring over time, the goal is to bring in other types of data to tease away at these factors, the additional non-clinical factors that impact human health. Okay. And the last application area for us is cybersecurity. I'm not an expert in cybersecurity. I work with people who are experts in this area, but the primary problem here is a data fusion problem and a prediction problem, where we are looking at, for example, network telescope data that looks at essentially traffic patterns across networks, along with network scanning and malware data when it is available, and to understand or predict coordinated attacks that might be coming. Okay, so that's, and there's a number of other topics that are part of ongoing work. I'll stop here and take any questions that you might have.
All right, thank you, Dr. Honavar. If you want to stop sharing your screen, we can get to some of those questions. If you have questions, you can drop them in the Q&A tab on the bottom of the Zoom video window. The first question coming in here is, let's see here. So where do we stand and where do we see the state of AI with regards to medical research being in the next decade?
I think a tremendous amount of progress is being made with respect to medical research. So it sort of depends on specific areas, but I anticipate that there will be lots of areas of medicine that would be impacted by AI in the coming years. So some areas, we have AI systems that are competitive with physicians. So for example, in radiology, that's been the case for quite some time. But I don't anticipate these systems ever replacing physicians. I anticipate these systems being sort of, assistants or provide another source of information that for physicians to act on. There is some preliminary data that shows that a combination of humans and physicians, when put together, can outperform each of them individually. So this is happening. It's only, I think, limited primarily by the availability of large, high-quality data sets. So once those data sets become available, lots of things can happen with the application of machine learning and so on. So for example, the healthcare reform, which required hospitals to maintain, electronic health record systems and make meaningful use of those, has led to current opportunities around using machine learning to look at many things which previously, we didn't have a data-driven approach to do.
And so given the rise of AI, what does the future of epidemiology and biostatistics education look like for future students?
I'm neither an epidemiologist nor a biostatistician, but I would say that based on my sort of outsider's understanding of those fields, I mean, a lot of epidemiology is about modeling of disease spread and disease risk and so on, right? Using data, and classic methods have been statistical methods where you usually have to make a lot of a priori assumptions about the underlying data distribution. So machine learning allows you to relax some of those assumptions and essentially look at more complex data sets for what they are. So in a way, I think there's a very, machine learning is essentially statistics on steroids, right? So we don't have to make distributional assumptions that could be completely wrong because now we have massive data sets, so we can relax those assumptions and look at, more complex relationships than a classic textbook statistical model could have produced. But it's so I think epidemiology and biostatistics and many other fields that have previously used data to come up with decisions or models would all benefit from advances in machine learning. So you could use machine learning to develop risk scores. Previously, you might have used some sort of formula with 5 variables. Now you could look at many more and see whether you can do more nuanced decisions.
So, are students able to participate in the AI lab, and is it extended to students on Commonwealth campuses?
Well, I mean, ours is a research lab. I mean, there is also an educational piece that we have through courses that we offer, I mean, through existing programs. But in terms of the research lab, there are summer research opportunities for students regardless of where they're located. But in general, research is not something that you can do at scale. The mentoring for research is it is one-on-one, often working with senior graduate students and so on. So the opportunities exist, but primarily through this research internships.
And so, let's talk about the fear that's associated with AI. Realistically, how fearful would be of?
I think you sort of dropped off towards the end of it.
So there's a lot of fear with what AI can do. Realistically, how scared should we be about the power of AI?
So I don't know whether it is about being scared, but I think as a society, there is a lot that we have to do to, ensure that we get the best of AI, the potential of AI to improve lives while minimizing its harm. And I think this has to be taken very seriously. It's not a topic that can be just left to people who develop AI technologies, computer scientists that work on algorithms, but the entire society has to be engaged in this conversation. And so there is clearly potential benefits of AI, right? There are, you could mine massive data sets and learn patterns that you couldn't learn before, and you could use those to improve outcomes in health or education and so on. There's lots of potential on the upside. But at the same time, it's also there's sort of two implications that, on the negative side that we need to worry about. One is the impact on jobs as they exist today, right? There will be many areas of work which part of what people currently do, spend their time on, could at some point be more or less automated. And that means that doesn't mean that all of the jobs will completely disappear, but those most of the jobs will change as a result of this technology over time. It may not happen overnight, but it will happen in our lifetime. The second piece is that the very power of AI can also be used to create chaos and harm. So you've all heard about deep fakes and fake news and all of these things, and which, before AI probably took a huge amount of effort for an individual to create, now could be, mass produced and create a lot of chaos in society and potential harm. So our legal and regulatory infrastructure is not quite ready for this yet. And that's something that needs to happen. So the technology is way ahead of where most of our laws are, and where we as a society are not quite prepared. So I would, personally, I'm an optimist. So I think these things have to be worked out, and they will be worked out. But it would require sort of, broader education of the entire population in terms of the implications of this. So it's sort of beyond technical education in building AI systems. I think everybody needs to sort of understand at some basic level what these systems can offer, what the potential harms are, and being ready to engage in conversations about societal implications of it.
So, question coming in from one of our guests: do you think the oversight of AI should be industry specific, such as healthcare or financial services, or at an overall level like federal regulation?
I think it, pragmatically, it would probably a combination of the two. There will be industry-specific aspects that would have to be dealt with. So, for example, FDA would be looking at, software as medical devices and therefore AI software as medical devices, right? When it comes to the care of patients. Similarly, if AI is being used in airline industry, then FAA would probably have to be involved, right? So there'll be industry specific things, but there are also some aspects of this that are sort of transcend particular applications and would be more broadly applicable.
Great. Well, that is all the questions that we have right now, and I'd like to thank Professor Honavar for joining us, and I also want to thank all of you who tuned in today to our virtual speaker session. As a reminder, you can find a full list of all of our events, whether they're online or in person, on our website at alumni.psu.edu. Thank you once again for joining us and for all you do for the university, for the glory, and for the future. We are
Penn State. Thank you.
Thank you.